I'm sorry to hear about all you've gone through. What I thought I would do first is run through the normal menstrual cycle and how natural conception occurs. That'll lead us into a discussion of some of the challenges that people have with getting pregnant, and then that'll lead us into a discussion of some of the testing you may want to get done. Do you know what you're looking at in this picture?
Yes.
This is the female reproductive tract. It's smaller than life size. It's cut in half so you can see inside. So this is the vagina, the cervix, muscle of the uterus. This lighter pink area is the lining of the uterus. That's what gets shed with the period. Fallopian tubes and ovaries. By convention, day 1 is the day a woman starts her period. That's purely so you and I and anybody you call in the office is going to speak the same language. Have you ever heard of the hormones estrogen, progesterone?
Yes.
These hormones are the female reproductive hormones. They get made by the ovaries and they get secreted out into the bloodstream where they do their work on all the other tissues and where we can also conveniently measure them. If I were to measure the levels of these hormones fluctuate in very predictable ways in women like yourself who have a very predictable menstrual cycle. If I were to measure the levels of these hormones on day 1, the day you start your period, or early on in the menstrual cycle, they're at their lowest levels of the month at that time. So the ovaries are hormonally quiet on this day. However, the ovaries are doing something else that's incredibly important and dynamic at this time. And that is, of the thousands of eggs that are in any given woman's ovaries, a handful of those eggs are going to get into a competition to try to ovulate for the upcoming month. You cannot see an egg, it's microscopic. Once an egg gets into the competition, though, a tiny fluid-filled sac forms around it, and that whole structure, the egg plus the fluid plus the cells that surround that, is called a follicle. And you can see these either surgically or more conveniently by ultrasound. And this is what it looks like. If I were to take part of the ovary, the edge of it, and cut it off, you'd see a whole bunch of structures that look like this. Okay, and this is a follicle. Now, what these follicles are competing for is a hormone from your pituitary called follicle-stimulating hormone, or FSH. Your brain makes this hormone all the time in super tiny amounts. Just before your period, your brain gets a signal to increase the amount of FSH that it produces. So now that hormone will flow through the bloodstream in great enough amounts that these little follicles will begin to compete for it on day 1. Over the course of a few days, one of these will win that competition. And when that happens, the cyst around that one gets bigger. As it gets bigger, it starts producing estrogen. The bigger it gets, the more estrogen it makes. Estrogen does a couple of things. One is it starts to prepare the lining of the uterus for pregnancy. The other thing it does is it feeds back to the brain, and that causes the brain to reduce the level of FSH back down to baseline. When the FSH drops, all the small ones that are not winning this competition will start a process of dying off, and this one will continue to get bigger and bigger and bigger until finally that estrogen is high enough for long enough, it triggers your brain to turn on another hormone, which is called luteinizing hormone, or LH. Have you ever done one of those ovulation predictor kits from the grocery store or drugstore?
No.
No? Some of your friends may have, and you may have seen them. That's what women are trying to measure in their urine. So the high estrogen from the cyst causes the brain to turn on LH. That comes down through the bloodstream. Most of it gets voided by the kidney, but a few of those molecules will join onto the cyst and cause the egg inside to mature and the cyst to rupture. So the mature egg pops out into the fallopian tube. Cyst remains behind, and now in addition, estrogen produces progesterone, which further prepares the lining of the uterus. During intercourse, semen gets deposited in the vagina. As you also know from real life, the vast majority of it falls right back out. A few of those sperm will find their way into the uterus, a few are still out into the fallopian tube. If egg and sperm come together, that's called fertilization. So that happens pretty quickly after ovulation. This structure is now called an embryo. It's going to spend a week-long journey traveling back up the fallopian tube. If it implants in the lining of the uterus, it starts producing a hormone called HCG. HCG keeps the cyst alive. The hormones from the cyst keep the pregnancy alive. They get into a mutually beneficial relationship until about 10 weeks when the placenta is fully formed. If there's no pregnancy, there's no HCG. If there's no HCG, the cyst dies. When the cyst dies, estrogen, progesterone drop. That fall in estrogen, progesterone causes the lining to shed. That fall in estrogen, progesterone is the signal that causes the FSH to rise again, and the whole thing starts over. Does all of that make sense to you?
Yes.
Do you have any questions about it?
No.
Okay. As you can tell from all of this is an incredibly complex process. And what we know is that humans are not very good at reproduction. If I were to line up many couples and they're trying to get pregnant, and I just followed them out over a year, what I'd find in that first month is about 15 to 20% of those couples would get pregnant. The next month, another 15%. The following month, another 15%. On the fourth month, though, it changes. It's more like 10%. And the next month, it's 6%. And it incrementally continues to drop off each month until you get to the end of the first year. When you get to the end of the first year, it levels off at about 2%. At the end of the first year, when you remove all the couples who have not gotten pregnant, you're left with 15% of the couples. That's the medical definition of infertility, inability to achieve a pregnancy after 1 year of unprotected intercourse. And it does affect, as I said, about 15% of couples. Any questions about that?
No.
Okay. There can be a lot of causes for infertility, but in general, we can break them down into 4 categories. One is a male factor, so we'll ask your husband to come in and give a sample that will be analyzed. Another can be problems with fallopian tubes and anatomical issues. So we'll do a test to look at the fallopian tubes. It's either called a hysterosalpingogram or a FemView. And what it involves is filling the uterus with fluid. If the tubes are open, we'll see the fluid flow out, and we'll take pictures of that. Another challenge can be problems with ovulation, ovarian reserve, and hormonal issues. So we'll do a series of testing on you looking at those things. About 20% of people who come in for an evaluation do not walk away with a satisfactory diagnosis. It's called unexplained infertility. It doesn't mean that there isn't a problem, it just means that I don't have the tools to figure out what it is. The good news is that the vast majority will find some sort of resolution to their problem. Do you have any questions for me?
No.